Hello, sir. I am Rihanna Rai and I am a content developer at Gravitas AI.
Okay.
So, today we have with us Dr. Nitin Deshpande, who is one of the leading ophthalmologists of India and heads the renowned Eye Institute, Shree Ramkrishan Netralaya, Super Specialty Eye Hospital in Maharashtra. So, I'm really pleased to meet you, sir, and thank you for taking the time to speak with us today.
Same here. Thank you.
So recently, Gravitas AI has deployed Tina at Shree Ramkrishna Netralaya for enhancing the patient journey and reducing the burden on the hospital administration team. So today, we will discuss with Dr. Nitin about the role of artificial intelligence in ophthalmology and how the pandemic has brought more focus on digital health. So can I go ahead with the questions?
Yeah, please.
Okay. So I wanted to ask you how the pandemic has impacted ophthalmologist practices in India, like in general, as well as your practice in particular.
So the first thing that struck us when pandemic started was that patient was very reluctant to travel to us because people are very scared of crowds and typically our OPD is crowded. So that big change hit us when basically pandemic started. Although we kept our clinic going with all the necessary care and COVID protocols, definitely patient footfall had reduced. And one interesting thing that we saw was there was a sudden digital shift to the whole practice because we started getting calls for on phone consultations, and because we had our operated patients from previous month who could not come physically and had to be attended to. Um, so a lot of and I think people got really used to going digital, in every way. You see the success of Zoom that happened, or see how your IT and all other offices were working online. Same thing happened to ophthalmology and overall medical field. And we started getting a lot of calls for online consultations. So we were quick enough to start online consultations. Only limitation of ophthalmology is we can't really look into the eye of a person on Zoom calls or online digital calls. So that is one limitation that we feel is there because we can't really evaluate eye in detail. But otherwise, we could really at least attend to patients to a large extent. Probably 80 to 90% problems could be solved at least. Are you?
I
Is my
think,
voice breaking?
yeah, yes, sir, it broke in the middle.
Mm. So
Yes.
we could attend to a large extent of large number of our patients, but still, I think we could tide over this pandemic because of help from digital consultation, and now that's part of our regular
Right.
regular option to our given to our patients through Tina, because we have integrated that with Tina also.
Yes, right. So I guess it's like now become the new normal to even use Zoom for
Mm.
eye appointments.
Absolutely.
So what's your opinion about progression of like digital health in specifically the ophthalmology sector and its impact on your practice and your patients as well?
It's a welcome addition because in a large populated countries like India, physicians can't reach to all the places. There is definitely shortage of trained healthcare staff in tier 3 or villages where the huge population of India resides. So if we wish to reach out to them, then digital is the only way to go for the future, because no matter how many graduates we churn out in healthcare industry every year, our population is growing at even faster rate. So to reach out to the people, I think digital is the only way. And in fact, it is a boon for our industry because we can reach out to people uh, in far-flung places where we could not reach out before. So yes, it's a boon for healthcare. That's what I feel.
Right. So also, what would be your initial feedback on Tina as your ophthalmic virtual assistant, and like what is your expectation from her, like from the technological aspect and everything?
Uh, the gap, the reason I looked into this was because I want my patient attended to in a better way. Because patients don't think that this is a working time and I should call in this time. So even if they call when my staff is not there, the patient should be attended to. That was my first intention. Secondly, a patient who is coming to us for the first time will have no idea what's going to happen to him. So if he gets some idea that which procedure he's going to undergo, or what is the procedure that what is the time he's going to spend in our clinic, or what to expect basically, how is my clinic going to look, or say if he's coming for a particular procedure like a cataract surgery, he should have some idea before actually coming to us, so he will be better prepared. He will know exactly what to expect from us, and he will come for he'll be forthcoming with his questions. So we save patient's time and our time both. So it is time saving, patient is better educated, he is less anxious, and I think that's a win-win thing. So that, so to the reason to go for Gravitas was to improve patient communication, and that was our main goal. So we have integrated our hospital videos, our brochures, and other patient education material in our Gravitas platform, and Tina will be forwarding those things to the patient. So I found that was the most important thing. And secondly, being able to attend to the patient even in beyond clinic times, that was another advantage. So patient won't feel that he was not attended to at any point.
Right, so like really glad to hear that Tina is helping out in such a good way at the hospital. And so do you also feel that even in the future, like she will help improve the productivity of Shree Ramkrishan Netralaya as well as the ROI?
Yes, because as we grow, as we add more clinics, Tina will be something that will hold us together. That's what I feel, because that will be one point interaction for whoever wants to visit our clinic in any locality. So that's a very positive thing about Tina. And it's a AI platform, so I'm sure it will get better and better with time. And team of Gravitas is very active in developing Tina, so I'm sure you will add more features in future, so that basically patient experience improves.
Yes, sure. And so, in general, how is your experience of, and with the Gravitas AI team? Like, is there any feedback you would like to give us? Any suggestion, maybe especially for the Indian market?
Well, the journey till date has been very satisfying, and you have really worked hard to integrate Tina to our requirement. So, and I'm sure we'll keep working in future. And I'm sure you'll share with us whatever new areas you feel we could work with Tina in future times. So the experience has been great with your team.
Okay, I'm really glad to hear that. So, thank you so much for taking the time out and talking with us today. It was like a great experience talking to you, and I hope we can talk soon again. Thank you.
Yes, thank you so much. Thanks, Arun.